It is important to consider the impact of community supports when integrating care for older adults. There are a combination of factors outside of clinical health care that contribute to their health and well-being. Medicare does not cover long-term care. So what happens when an older adult is unable to prepare meals in their kitchen or is unable to drive to their physician's office? Our ability to manage our health is influenced by a complex mix of personal, social, physical, and economic factors. As such, it is critical to incorporate community or social supports into the planning and care of older adults. So, what are the social determinants of health that impact older adults in the community? Overall, there are 5 determinants of health. The first 2, genes, biology, and health behaviors, make up about 25% of the health outcomes of a population. The other determinants include characteristics of our social environments, such as culture, income, or gender, our physical environments, living situations or air quality, and access to medical or health services. Together, these factors contribute to our overall ability to influence, address, and impact our health outcomes. Why does this matter for older adults? 10 to 15% of older adults live below the poverty level. This figure increases for older women and older adults of color. Income disparities also increases as we age and as opportunities to earn and save become shorter. Also, our physical needs and adaptations needed within our physical environments shift over time. This impacts our access to grocery stores, medications, and health services. It is important to remember that in every community there is an existing community infrastructure available to help support the social determinants of health for older adults. At the center of that infrastructure are information and assessment services, community service providers such as Meals on Wheels and adult daycare centers, and ongoing care management to help manage, coordinate, and integrate services in the community. Together, this basic infrastructure is able to support clinical health care needs through ongoing chronic care management done through services such as evidence-based health promotion classes and nutrition consultation, diversion or transition from long-term nursing home placement through caregiver support and respite, minor home modifications, and personal care, and avoiding hospital admissions and readmissions through transportation to physician appointments, health coaching, health care benefits, counseling, and medication management. For individuals, caregivers, and practitioners, it is important to know where to go when there are questions about community services. If you think of long-term care as a continuum that can be accessed through many points, think of the local Aging and Disability Resource Center as the front door through which you should always enter. The ADRC is a locally operated call center staffed with certified information and assistance specialists. They can answer questions about what types of services are available in the community. They can also schedule long-term care assessments to help determine eligibility for private programs.
Take a moment to think about the needs of older adults living in the community. What are the services or resources they request the most to keep them healthy and safe at home? Each year, the ADRC screens 13,000 people for their service needs, and this list represents the services most requested. As you can see, each of these services can impact the social determinants of health of an older adult. But although these are the most requested services, it is also important to understand the resources available in the community to provide these services. Not everyone can afford home-delivered meals or emergency response systems. Similarly, community resources, such as the Older Americans Act or community block grant programs, are limited. For older adults and people with disabilities who qualify for Medicaid and meet certain level of care requirements, individuals can receive community services through Medicaid waiver programs such as Passport and MyCare Ohio, instead of receiving services in a nursing home. But overall, Medicare does not pay for long-term care services and supports.
If there is one takeaway from this portion of the training, it is to call the Aging and Disability Resource Center at the local area agency on aging with any questions about what community resources may be available to support an individual's needs in the home.